Let's discuss antifungal agents. Most fungal infections are opportunistic and happen in immunodeficient patients like AIDS patients, in cancer, etc. So, classification of the drugs. First, we have polyene antibiotics such as amphotericin B. It is an amphoteric compound, so it is not totally water soluble. You can't give it orally. And also, what it does is it binds to ergosterol in the cell membrane. Any membrane, it binds to ergosterol and forms pores, polypores, many pores, and causes leakage of cellular contents and death of the organism. Next, Echinocandin antibiotics. Echinus means porcupine, right? So it's like Pierce IV injection. Okay, it inhibits the synthesis of glucan in the cell wall. Okay, then you have Graciosalvin, which is a mitotic spindle poison. Azoles, which inhibit ergosterol synthesis, and allylamines, which again inhibit ergosterol synthesis by inhibiting squalene oxidase. Okay, so let us discuss the superficial mycosis. You have dermatophytes, trichophyton, epidermophyton, and microsporum. And deep mycosis, you have ABC, aspergillus, blastomyces, and cryptococcus and candida. So moving on to amphotericin B, it is a broad spectrum fungal antibiotic. So pharmacokinetics, it is not absorbed from the gut. You give it IV. It is highly bound to plasma proteins, and that is why it is poorly distributed. It can poorly cross the blood-brain barrier because it is bound to plasma proteins. So mechanism of action, it binds tightly to ergosterol in the fungal cell membrane, forms pores, and leakage of intracellular contents. So what are the disturbances? It is highly nephrotoxic and hepatotoxic and causes anemia also. So that is why it is not used much. So formulations, it is poorly water soluble. It is amphoteric. So it is combined with AB, so DC, deoxycholate amphotericin B, and liposomal amphotericin B. Liposomal is targeted drug therapy. So azoles are mostly used because it is highly toxic AMB. It is effective in almost all systemic mycosis. Next, nystatin, it is used in candida infections. It is used topically. Okay, next, echinocandins. So in the cell wall, they inhibit glucan. They candle light. So candle burns fuel. What is a fuel? Glucose or glucan. It burns glucan in the cell wall. Okay, so it can be used against candida and aspergillus. Okay, IV infusion. It is metabolized in the liver, excreted through the urine. Okay, next you have Graciosalvin. Mechanism of action is it interacts with polymerized microtubules. Okay, and then disrupts the mitotic spindles, and it is a spindle poison. It is given orally. It is an enzyme inducer, and it is used in dermatophytic infections. Next, antimetabolites, you have flucytosine. Okay, flucytosine is a prodrug. What it does is it converted into 5-fluorouracil within the cell, and it inhibits it interferes with fungal DNA synthesis. Okay, so then again you have differences between amphotericin B and flucytosine. So it is an active drug and it's a prodrug. It has a broad spectrum of activity, narrow spectrum of activity, and it is antifungal. It's an antimetabolite, and you give flucytosine orally. Okay, amphotericin B is IV. Okay, and amphotericin B is plasma bound, so it cannot cross the blood-brain barrier. So flucytosine is not plasma bound, so it can freely cross the blood-brain barrier. Okay. Next, moving on to the adverse effects, again bone marrow suppression with anemia, nausea and vomiting, and diarrhea. So azole antifungals are divided into imidazoles and triazoles, and what they do is basically impair ergosterol synthesis. Okay, so examples are clotrimazole, topical cream for candidiasis. Next, if you don't know what to try dermatophytic infections. So Graciosalvin, dermatophytic infections. Next, flucytosine, candida. Again, it is used in combination with AMB for cryptococcal meningitis. Okay, mitotic spindles, right? Next, ketoconazole. Again, it is used topically for various fungal infections. It is a prototypic drug. Then pharmacokinetics. Acidic environment favors the absorption of ketoconazole. It's ketone, something like that. So acidic. So bioavailability is reduced by drugs which reduce HCl, so H2 blockers. Adverse effects. It is the most toxic among azoles, but it is less toxic than amphotericin B. Okay. What are the adverse effects of azoles? So local irritation, itching, or burning. Next. Again you have fluconazole and the other things. Itraconazole, which is synthetic. Fluconazole is a triazole. Okay, next you have allylamine. So example is terbinafine, which inhibits squalene 2,3 epoxidase and blocks ergosterol synthesis. It is well concentrated in skin, nails, and epidermal tissue or adipose tissue. Okay, so what again you can use it in dermatophytosis. So topical agents include Whitfield's ointment, 6% benzoic acid and 3% salicylic acid. Okay, so benzoic acid has antifungal effects and salicylic acid has keratolytic effects. Okay, so remember KMC fit. So KMC, ketoconazole, miconazole and clotrimazole, topical. Fit, it is fit for systemic administration. So F for fluconazole, I for itraconazole, and T for terbinafine. This is all about antifungal drugs.